that the transmissibility might be worse, but the actual severity of the disease might not change, which basically means I don't think we should be that worried in that sense. Once again, we have to monitor the tracing and the vaccination. We just need to monitor and change the compositions and the tracks of these two things that I just mentioned. And then we just go from there based on how the circumstances lie.
Okay, thank you so much, Dr. Sima.
Let me come here because this is very vital question.
Okay.
I think Dr. Abdelamir, the so far virologist and Professor Elani from actually University College London and other colleagues in their report to the Science Committee of the British Parliament day before yesterday, they were very specific and very clear that the misuse of antiviral treatment, which WHO recommended not to use, may be one of the major source of the mutation. I qualify it with maybe. So they definitely all agreed that the changes in the virus is the source of the mutation rather than the behavior of the people. So why the virus changes, it's actually in response to what happened in our bodies, you know. The vaccine, of course, is not a treatment. Vaccine is basically given to healthy people. And we recommend strongly that all healthy people, include those who recover from the virus, should take the opportunity of having the vaccine. Once the mutations are detected and reported, before I answer your second question, the changes of the vaccine is very easy, as we've seen, because the technology is available, as we've seen with the flu. The flu vaccine we change every year. Last year vaccine component is different than this year vaccine components because we add whatever mutation happened in the coronaviruses or the flu. The last point you said, is it happening in specific countries, not other countries? We don't know. To be very honest with you, simply because of gene sequences and the ability of each country to detect changes in the viruses. Iran, for example, they reported the same strain which exists in United Kingdom. Although there is no flight between the two countries. So we don't know whether this is actually changes in the virus happening in Iran. But Iran have gene sequencing ability. Other countries, they don't have. As I said, the United States is about 5 times bigger than United Kingdom. Yet they have very, very low capacity for, not capacity, but or willingness to do gene sequences, which is really shame, you know. And I'm sure if they do the extensive gene sequences, they will discover the same variant or even different variants in the United States.
Okay, thank you so much, Dr. Salman.
Can I ask one question?
Yes, Dr. Majid.
I would like to ask Professor Salman and also to the opinion of Dr. Abdelamir, since they referred to increased cases in children in Basra, as among other countries, Professor Salman, is this a new surge in cases? Because I'm in contact with other colleagues in Suleimania and Erbil and things, and they have a number of children as well. But it was related to the original if you like, variants. And if so, if this surge is high, are they doing the genetic sequences in Iraq? Have they detected the mutation? Thanks.
No, they don't have. Iraq, they don't have gene sequencing facilities at all. Most of the IMRO region, they don't have that except Iran. I don't know whether Egypt has such facilities or not. So far, we received from WHO IMRO information, actually a couple of emails today exchanged, because we are trying very hard to provide Iraq with facilities for gene sequences. And I think the minister last night in our meeting of the COVID committee agreed that he will fund 2 machine, reagent, and software. It's a very complex process, and you need to train a good number of people. For your first part of the question, Ali Rahim from Basra, which you know, I'm sure, reported new cases, which he never seen before, and he reported reinfection. Iraq collect data on reinfection, and Dr. Riyad yesterday instructed all the hospitals to provide data on reinfection. So hopefully we will know about it today, tomorrow.
Thank you. Probably it is too early also for UK, because especially now the Royal College in recession of pediatrics.
Okay, thank you so much. Any question?
Yeah, I have a comment from David.
Sure.
Yes, Dr. Fadel, yes, you have questions?
Yeah, I have last question. I want to ask Dr. Seema.
Yes.
Even on theoretical level, vaccine can be blamed to be a cause for emerging a new variant or new strain of COVID?
No.
Okay. No, absolutely.
No. There is no evidence. This is only a conspiracy theory. And right now is finally the time for us to totally eliminate conspiracy theories and work based on scientific information and knowledge.
I think I 100% agree with Dr. Seema, because the mutation, the current 6970 mutation in the UK happened in September, long before the vaccine.
Yes, exactly.
Number one. And secondly, it's covered 72% of the population in Southeast England, you know, yet in Southeast, the entire country, we managed to immunize only 800,000 by tonight, you know. So,
yes.
So all this about linking the mutation to the vaccine is nothing but rubbish. And we have to say rubbish. Are you?
I just like to add one comment.
Yes,
that Dr.
Salman.
Yes. Dr. Salman pointed to the point. Unfortunately, we're going to have to wait until mid-January for the United States to go 100% to use all its technology capacity, because for the past year, the administration here in the United States has not been committed to that. So that's number one. So unfortunately, we will be getting to that point. But also from a clinical perspective, we have to be careful, because the tendency in clinical medicine, and this sometimes is driven by trying to create guidelines or sometimes being more cost effective, that we start saying, this is how we're going to handle certain patients. This is how we're going to treat them. And this is a rapidly evolving disease process, and also a rapidly evolving capability, because we're talking to people from all over the world. And as Dr. Salman is mentioning, that some people have certain capabilities or not technologically wise. So we have to understand that if we're seeing a failure, or if we're seeing a manifestations of new mutations, the question really is that because the patient was really not afforded the best treatment from a clinical point of view? Because when we talk about a mutation, and maybe Dr. Khalid can answer this, when you talk about a mutation, just having a mutation doesn't mean you're going to get a clinical disease, because then you have to talk about inoculation dose. How much viremia do you have to get a clinical manifestation?
Well, I mean, I cannot answer this question categorically, because the viremia detection, so far we do PCR, which is a qualitative, not a quantitative DNA test, like what we do with CMV or EBV or HIV or even hepatitis. So that is that is one thing. I agree that there is a rush to do everything to the patient who are dying by giving them any antiviral medication, which could well be, as been indicated, to the cause of mutation. There is another thing. There was a paper about saying that one cause of mutation could be the plasmid given to the immunocompromised that may help to create mutation. And the other thing about the surveillance. Now, let's not forget, because we are much better in surveillance and trace and detection in the last 3 months or 2 months. What about the previous months? So the picture is not quite clear. However, the domination of the new strain is actually a serious thing and is alarming. But I mean, we are waiting for that. Having said that, it is very unusual for too much mutation in the virus to happen now compared to the previous months. And I mean, initial literature saying that COVID does not accumulate mutation compared to, flu viruses. However, this is a new thing that we have to watch. And as has been said, it could be that we are having a different clinical picture of COVID compared to the earliest one.
Okay. In 1 minute, I want answer about this question. Is this new strain was expected? And in the worst scenario, more strains can be emerging. I want answer about this during this webinar.
I think Dr. Khalid said
it depends on it.
A mutation happening in all type of viruses. But is it expected? I doubt it very much. But I think, let me finish this with some positive remark. If you look at the virology of the new strain, the way virologists describe it, the new variant actually added about 6 spikes to itself, But at the same time, which is the good news, this is the bad news. The good news is deleted 2 spikes.
Yes.
So as far as the virus start deleting some of these spikes, as we've seen in SARS-1, for example.
Defect virus.
It started to go inert in no time. So scientists now looking at these positive things, hopefully the next mutation will delete more spikes and the whole thing is over. We don't know. God only knows.
Okay. Thank you so much. Thank you. It was a really very informative talk and lecture to improve our knowledge about last update on COVID-19. We will meet you next webinar with a new trending subject. See you and stay safe, please, and Happy New Year.
Merry Christmas.
Thank you.
Thank you.
Thank
Happy
you.
holidays.